Okay, good afternoon everyone. My name's Liz Hing and I work at Cancer Council New South Wales. I'm a health coach on the Healthy Living After Cancer program, and this is actually my first conference presentation, so bear with me with the slides. Oh, went the wrong way. There we go. I'm going to start with a bit of background on the project. Healthy Living After Cancer is an NHMRC project. The partner organisations are Cancer Council New South Wales, Victoria, WA, South Australia and the University of Queensland. We're evaluating the integration of an evidence-based telephone-delivered health coaching intervention for cancer patients, cancer survivors actually, into Cancer Council's 131120 Information and Support Service. Oh, I've gone the wrong way, sorry. The program's supported by a team of Australian and international investigators with expertise in a variety of cancer survivorship areas. And on the ground, there's a number of staff that work in various cancer councils in the New South Wales, Victoria, South Australia and WA, and we're well supported by project coordinator Erin in University of Queensland. Now, as you can see by the red line, cancer survivor rates for the majority of cancers have been steadily improving in Australia over the past decades, and this trend is expected to continue. So you can see that going up, and you can see that the number of deaths, which is the grey line, is not rising. And this is obviously great news. Cancer survivorship, however, is associated with an increased risk of cancer recurrence, development of new cancers, persistent side effects, such as fatigue and some comorbid conditions, for example, cardiovascular disease, type 2 diabetes. And actually, as Jane Turner said in the plenary speech, she said, these patients aren't as good as new. And that's right, and that's why they welcome and like a wellness-focused program such as this. So to improve the longer-term well-being, national cancer organisations recommend that cancer survivors engage in regular physical activity, eat a healthy diet, keep their weight within a healthy range. And although cancer survivors actually do express a strong desire, to do this and to make these lifestyle changes, many do struggle without support and advice. So there's also a large body of evidence supporting healthy lifestyle interventions for cancer survivors and those that use broad-reaching modalities such as the telephone, but such programs aren't routinely available or offered in survivorship care. That's why this is where Healthy Living fills the gap. So a quick overview of the program. Healthy Living After Cancer is available to any adult who's been treated with curative intent for any type of cancer who've finished their treatment, their active treatment. Those who take part receive 6 months of telephone health coaching delivered by a Cancer Council health coaches or nurses, focusing on healthy lifestyle changes. And they are, of course, engaging in regular, physical activity, eating a healthy diet and maintaining a healthy weight. And I just want to add, as in the panel earlier today, they talking about, other stuff that comes up, the other stuff. And of course, we do get people talking about the other stuff as well. And that's really important. So we're also seeing sometimes, or, people talk to us about other concerns that they say, oh, I don't want to bother my family, or I don't want to bother my doctor with this, but. So apart from the health side, I do see this other side creeping in quite a lot as well. So participants complete a telephone survey at the beginning of the program and at the end of the program, and again 6 months later. They're asked to self-report their weight as well as their height, so we can calculate their BMI, their waist circumference, and also a range of questions around their physical activity, their diet, quality of life, treatment-related symptoms, side effects, cancer, fear of cancer recurrence, distress, and a range of demographic questions. And the items that are in bold on there, they're the ones that we're going to focus on today and discussing preliminary results. The Healthy Living After Cancer intervention is based on the following evidence-based guidelines for cancer survivors. These are in line with the national guidelines around maintaining a healthy body weight, doing 30 minutes or more of moderate intense physical activity, and the national guidelines in diet especially around eating the 5 serves of vegetables, the 2 of fruit, and limiting alcohol consumption. Our target group, as I've mentioned before, are adults who've completed treatment for any cancer with curative intent, and they've completed treatment, although they can be on hormonal therapy such as Herceptin. Participants are screened for eligibility by Healthy Living After Cancer staff members at one of the cancer councils before commencing the program. And look, if there are concerns about eligibility, the cancer survivor may be asked to speak to their GP or their specialist. We can also contact the project coordinator in UQ and ask for guidance, and she can take our questions to the clinical investigators that are on the project. And we've also got a project FAQ that's constantly being updated and circulated regularly, which details interesting or challenging cases. So we've got a lot of support around the people that we're looking after. We anticipate that approximately 50 completions per year per cancer council, and over a 3-year service delivery, that will be approximately 600 completing the program. Participants are referred to the program through a range of referral pathways. We're aiming to promote the program to regional and remote areas as much as we can, because we know that telephone delivered programs are particularly beneficial here, and especially as there isn't, as we know, a lot of other stuff available in regional areas. And this is looking nationally so far across all of the cancer councils. We've got 334 referrals, with 81% eligible and 94% consenting to take part in the program. The main referral pathway has been our 1311 telephone service. The main reason for ineligibility and refusal are disinterest in the program, or we've been unable to contact them for screening or consent. And so far, 287 participants have completed the pre-program assessment and commenced their intervention calls. And here's a bit of a summary of New South Wales. New South Wales is actually the lead state for healthy living after cancer at the moment, with 132 referrals, 85% screened eligible, 91% consenting. The average age of our participants is 55. The majority are female, with an average BMI of 28, and the average number of years since their diagnosis is 3 years. And here's some interesting statistics on just New South Wales. 80% of our participants are from metro areas, and we have actually a disproportionately more participants from most disadvantaged or least disadvantaged areas. The majority of our participants, as you can see, have had breast cancer. We do also have a small number of participants who were diagnosed with rarer forms of cancer. I'll be talking in a moment about our preliminary results of the psychosocial outcomes, but it's interesting to note that many of our participants during their pre-assessment report struggling with anxiety and depression. To date, we have a completion rate of 62% with 27 completers from Cancer Council New South Wales. Participants receive on average 10 intervention calls. The main reason for withdrawal are feeling like they're not benefiting from the program, or we've been unable to contact them for their intervention. So, the results. This graph shows some of our preliminary results, and as you can see, the results are very promising, and the results are on your right-hand side down there, and the ones in bold are the ones, obviously, that are doing the best. I'll go into the psychosocial outcomes in a minute, but I just wanted to highlight a couple of results that we're particularly pleased to see. If you look at the fruit and veg, has increased, and that's actually particularly hard to get people to increase the amount of fruit and veg, especially veg, that they eat. So we're really pleased about that, and also very pleased about physical quality of life. Because again, it's really hard and complex to get people to make, long-term changes or any sort of changes around increasing their activity and around exercise. So we're very excited by the results we're seeing so far. So I'll now give you more detailed information on our psychosocial outcomes. So the quality of life was measured using the SF12 health survey, and our preliminary results show a significant improvement in physical health quality of life from pre to post program. However, although it's trending in the right direction, there's no significant improvement in mental health quality of life. Cancer and treatment-related symptoms and side effects was measured using the MD Anderson Symptom Inventory. Our preliminary results show a significant improvement in symptom severity from pre to post. There was a corresponding significant improvement in symptom interference from pre to post. Distress was measured using the National Comprehensive Cancer Network Distress Thermometer. Our preliminary results show no significant reduction in level of distress on impact of level of distress from pre to post program. But as you can see, our participants reported an overall low level of distress to begin with, 2.9 at pre-program on a 10-point scale. And as I mentioned previously, the average number of years from cancer diagnosis and treatment of our participants is 3 years. And so it may be that our participants are simply no longer feeling that distressed, and that's why we're not seeing that improvement in our from pre to post. Fear of cancer recurrence was measured using the Concerns About Recurrence questionnaire. Our preliminary results show a significant reduction in fear of cancer recurrence from pre to post. Now, this is what I really like. During the post-program telephone survey, participants have been asked a range of questions on their satisfaction with the program, and here's a little word cloud that's showing some of the most frequently used words. We've received wonderful feedback, really positive about the program, and it's, as you can imagine, yes, it is helping them increase their fruit and veg and physical activity, but it's really also helping their mental well-being, and they're feeling so much more like getting on with life. And so finally, I'd like to just leave with some quotes. I like the last quote. I felt more supported, especially after my treatment. Even though people thought I was okay after my treatment, I actually wasn't. So it was so beneficial for me in participating in this program. I felt so supported. And this one, again, people ring 13, 11, 20. They're ringing the program not about they don't know this program exists. They're ringing the program because they're feeling like they need support, they're feeling down. So I like the last one here. I didn't join because I wanted to get healthier or improve myself. I rang Cancer Council because I was feeling very down after finishing my treatment, and the program was offered to me. Even though it was being a bit depressed, that was my reason for contacting the Cancer Council. Doing this program helped to get me out of that, to get me out and get fitter and doing things. So, how do you find out more? At lunchtime, come and see me, Or if you're from interstate, call 13 11 20 and speak to your Cancer Council. New South Wales, you can email us directly at that email address. We've also got a web page with our referral forms on it. And, questions. First, and I'd also like to thank UQ Queensland, who gave us who sent me down all the figures, especially Erin Robson and Liz Eakin, and all my Cancer Council HELAC staff across Australia, and my Cancer Council New South Wales buddies out there.